Friends, today we will discuss about porcelain gall bladder. How to recognize porcelain gall bladder on ultrasound. That means what is its Sono criteria. Porcelain gall bladder is a form of chronic cholecystitis where having mural calcification. That means severe calcification of gallbladder wall. It's a precancerous condition. That's why you must go for prophylactic cholecystectomy. Otherwise, it results into gallbladder carcinoma. Let's discuss some indications of prophylactic cholecystectomy. Indications are anomalous pancreatic biliary ductal communication, choledochal cyst, gallbladder adenoma, porcelain gallbladder, solitary gallbladder polyp having size more than 1 cm. Other indications are CBD stone or choledocholithiasis, gallstone having size more than 3 cm, sickle cell disease, on peripheral blood smear examination having spherocytosis, person with organ transplantation or immunosuppressive therapy. These are the indications of prophylactic cholecystectomy. Now discuss about X-ray features of porcelain gallbladder. It appears as a ring of calcification at expected location of gallbladder. Gallbladder has a variable location. That means it has not a fixed location like ovary. So you have to search or scan entire right upper quadrant of abdomen, that is from midline to mid-axillary line. If a ring-like calcification is present in this region, you should think it has a porcelain gallbladder on X-ray. This slide shows a ring-like calcification at expected location of gallbladder, that is ring-like calcification at the level of L1 and L2. Ring-like calcification at expected location of gallbladder, which is due to calcified GB wall. This slide again shows ring-like calcification at expected location of gallbladder, which is due to calcified GB wall. This slide again shows ring-like calcification at expected location of gallbladder, which is due to calcified GB wall. Now discuss about Sono-features of Porcelain gallbladder. Due to severe calcification of gallbladder wall, when ultrasound beam comes and strike on it, all or almost all the ultrasound beam are reflected back to the transducer, so the area just below the it remains non-scannable. That is, gallbladder lumen itself remains non-scannable, which appears as a semilunar ring. Second, anterior and posterior calcified wall will appear as hyper-echoic line and lumen in between. In very brief, anterior and posterior calcified wall will appear as a hyper-echoic line having a lumen in between, which itself is a non-scannable. Lumen appear as dark or black in color. This slide shows ultrasound features of porcelain gallbladder where anterior and posterior calcified wall appear as a white line, that is a hyper-echoic line having a lumen inside. Lumen appear as a dark or black in color due to it is a non-scannable area. See the slide where anterior and posterior layer appear as a white line having a lumen inside, which itself is a non-scannable area. That's why it appears as a dark or black in color. Left side of the slide shows ultrasound features of porcelain gall bladder, and right side of the slide shows X-ray features of porcelain gall bladder. On left side, X-ray shows calcified gallbladder wall. On right side, CT scan shows coronal section of gallbladder where calcified wall is easily visible. On left side, X-ray shows calcified gallbladder wall. On right side, CT scan shows coronal section of gallbladder where calcified wall is easily visible. On CT scan of abdomen, both in coronal and axial section of gallbladder, where calcified gallbladder wall is easily detected. Now discuss about differential diagnosis of porcelain gall bladder. Some form of chronic cholestasis are difficult to recognize on ultrasound from porcelain gall bladder. Out of these, wall echo shadow most confuses for recognizing. Others are xanthogranulomatous cholecystitis, emphysematous cholecystitis, and traditional chronic cholecystitis. See the box where you confuses for recognizing on ultrasound from porcelain gall bladder. Now discuss about some ultrasound features of wall echo shadow. Please go through my previous video on wall echo shadow where I have clearly described about it. What is waist triad and waist complex? Waist triad or waist complex is seen in case of gallbladder filled with multiple gallstone or gallbladder packed with stone and lumen cannot be appreciated. Waist triad have three features. First, two hyper-echoic line. Second, two hyper-echoic line is separated by a hypoechoic interface. Third, posterior acoustic shadow. Upper hyperechoic line is formed by gallbladder wall itself. Lower hyperechoic line is formed by multiple pegged stone inside gallbladder, and hypoechoic interface is formed by muscular layer of gallbladder and bile inside. Due to presence of multiple gallbladder pegged stone, it produces posterior acoustic shadow. This is waist complex or waist